We go on to the other modalities which I use include physical rehabilitation, strengthening and stretching exercises. Physical therapy and rehabilitation are important parts of my dynamic model. Patients suffering from chronic pain often develop associated physical disabilities, leading to a decrease in or loss of functionality in the ability to walk, bend, use stairs, or perform routine errands such as grocery shopping or simple chores. Strengthening and stretching exercises and actively resisted exercises, the movement or exercise of the body against a resisting force, increase power, strength, and neuromuscular and cardiovascular conditioning. In addition, I recommend walking alternated with jogging, which can help build stamina and recondition the muscles. There are other adjunctive treatments which I use in my pain management center. They include hard packs, electrical stimulation. The application of heat by means of a heating pack can often control pain and speed the healing process, though it is adjunctive in nature and limited effects. The application of heat interferes with pain signals being sent through your spine to the brain, especially myofascial and neuropathic pain. Moist heat is commonly used in my practice. Electrical stimulation. Electrical stimulation of the skin is commonly used in my center as an adjunctive modality, primarily to excite the peripheral nerves, to produce analgesia and improve microcirculation to the muscles. Now, very important part of the pain management at my center include psychotherapy, which can be individual, family, or group psychotherapy. The psychological and psychiatric treatment of chronic pain patients is an essential part of my dynamic model. The biopsychosocial model of illness understands the clear link between body and mind in evaluating and treating pain. It is important to recognize the all-pervasive nature of pain, which affects our thoughts, attitudes, emotions, and behavior. In turn, our thoughts, attitudes, emotions, and behavior affect how we react to and recover from pain. When a patient comes to me in my center, my wife, Dr. Sukhveen Kaur Ajrawat, conducts a thorough evaluation and reviews every aspect of patient's life that is pertinent to his or her physical illness. After a thorough evaluation and concrete diagnosis, the patient is gently guided to participate in individual, group, and family therapy. Various therapeutic approaches are used, including operant conditioning and behavior modification. In addition, patient education and improving the patient's self-esteem are two very important components of our psychotherapeutic approaches. Now, the other important part of the multimodality treatment includes the pharmacotherapy, that is use of narcotics, non-narcotic analgesics, antidepressant, and some other pharmacotherapeutic agents. Medication can serve an important role in treatment. However, in too many cases, patients are over-medicated for conditions that can be treated in other ways. For example, a patient named JR came to see me suffering from panic attacks, headaches, and depression. He had been taking over-the-counter medication for these problems for many years before he saw me. He was prescribed Demerol, Imitrex, morphine, and other medication by his doctors, but still JR's problem persisted. I reduced the medication JR was taking and put him through a regimen of injection therapy, meditation therapy, and exercise. JR's health began to improve dramatically, and he was able to lead a pain-free life without excessive dependence on medication. Dr. Ajrawat's Air Pulse Autonomic Therapy. With all patients, whether suffering from chronic physical pain or day-to-day stress, I use air pulse autonomic therapy. Combined with other components of my pain treatment plan, such as varied and regular exercise, alternated walking with jogging, balanced nutrition, strengthening and stretching exercises, and the practice of correct principles, one can achieve not only a physically healthy mind and body, but also a self-actualized and empowered self as well.